Hi everyone, my name is Nikita and I am BIMA Culture and Arts Team Leader.
And my name is Diksha. I am the events officer for the BIMA Culture and Arts team.
So we'd like to welcome all of you to our special interview today with none other than Dr. Veena. So she needs no introduction, but even so, just a quick intro that she's a GP in London and she's also a fantastic professional dancer. We're very, very excited to have Dr. Veena with us today because we're so inspired with the way that you, Dr. Veena, juggle your time, between medicine and dance. And so we just wanted to use this interview as an opportunity to get to know a bit more about your journey, not just for ourselves, but I'm sure for many listeners too who would be interested. So I'll throw it across to you first. If you want to tell us a bit about yourself, and then we'll go ahead with the burning questions that we have. So.
Oh, hi guys. Thank you so much for having me. I'm so happy. You can just call me Veena. That's fine. Okay. The Insta handle is just so people know what I do. That was really kind of you. Thank you so much. So yeah, it's pretty much what it says on the tin. I'm a full-time NHS doctor and I love to dance. I've been trained professionally. I used to freelance and dance and teach and perform throughout my teens and during med school. And when I became an F1, I decided to start a YouTube channel just as a creative outlet. And then it kind of went from there. Kind of just kept it going with medicine and yeah.
Okay, great. So I think we'll start off then with our questions. The first sort of theme that we're going with is about dance and medicine itself. So Sliksha, would you like to take it away with the first question?
Yeah. So what do dance and medicine mean to you and how do they complement each other, if at all?
Oh my goodness, that you went straight in with a big question. So for me as an individual, I don't think one can exist without the other. And I say this because I always tell my students, just the way that there is an art to medicine, I think there's a science to dance. There have been times in my life where I've just focused on my academics and not creatively done anything. And I've seen the difference. I've been more stressed. I've not been able to perform as well. I felt more down and low in myself. And I've compared it to moments where I've balanced the two. It's allowed me to de-stress. It's allowed me to elevate my work to a much higher place. It's allowed me to reach others, inspire others. And more than anything, it just makes me happy. And I think that's key, where you have a passion for something and people always ask me, how do you make time for it? How do you find the energy after long days at work? But when something truly brings you this much happiness, you make time for it. You create time for it, even if it means you come back from 12, 14-hour shifts, or you wake up earlier before work, or it might be after a set of nights, you make your way down to the studio or a location shoot, because creating, developing, learning, kind of experimenting, putting things out in the world and seeing what happens brings me actual joy. So I think that's the connection between the two. And it really, I think dance has also helped to medicine in the sense that the more creative I am and the more I push myself in the studio or physically, I find that I have a lot more energy when I'm at work. Thank God, I've not really become sick very often. I feel like my immune system is quite good. I'm very active, I'm very agile, I have a lot of energy. And I think a lot of that comes from training, the aerobic exercise that you do, the way that you strengthen your muscles and your joints. And I'm sure you guys understand, at work, because of our work, you see so many sad situations where people may not necessarily have the strength or have the health to do things, right? And when we have able bodies, I just think it's such a privilege to be able to try and push yourself to see what you can do. And I think that's a big thing as well, just being passionate about movement and getting others excited about it.
Right. Yeah, that sounds amazing. And I really like how you spoke about, how they sort of drive each other, instead of things in isolation. Always people see them as separate commitments almost, but I like how you link the two together. So that was really nice to hear. So in terms of when you look back on your dance journey, your medicine journey, what's your sort of fondest memory or achievement in relation to the two? Can that one thing or two things?
I think in relation to the two, it has to be, and this isn't an old memory, this is memories that keep happening. It has to be of either students or academics who stumble upon either the channel or my work or meet me in person. And the first thing they always said to me is, I didn't realize it was possible. I didn't realize you could keep your passion alive while you're working full time. Because, guys, I'm sure you've heard this. I heard this all throughout med school and towards the end. So when you're planning to quit, when you're planning to stop, surely when you're married, surely when you finish, surely when you work as a doctor. And I remember believing it after a while, right? Because everyone kept asking so much. And I thought, oh, maybe I should stop. So I told myself, maybe try get everything done in a few years, get out of your system. But what I've come to learn over the last few years is, I think people often put their expectation and societal standards onto you, but that doesn't necessarily need to be a reflection of where you want your life to go, So they may not necessarily come from a bad place, but you have to be careful what you allow to integrate into your mind. Because for a lot of people, that can become their truth, that everyone convinced them to stop music or reading or writing or cinematography, and they stopped. But they could have created the next best piece out there, or they could have, inspired others. But in the same, in a different vein, you need academics and you need people who just focus on one thing, and you need those specialists, right? I'm not saying there's any harm in doing that or that's a bad thing, but if you truly have a passion for something, I don't think you need to get into that mindset of, I have to give one up. You don't have to. You can succeed in both. Of course, there'll be some opportunities and jobs that come up where you have to sacrifice. Fact, you have to sacrifice. But if you're okay with that and you understand what the reality will be, I personally think you can find a lot of joy from both careers.
Right. Okay. So you feel like you've sort of come across a lot of people who've changed that mindset then, in terms of balancing their passion with their academic kind of.
Yeah, definitely. So often it's medical students, dental students, pharmacy students. It's all the science students, right? A lot of my following is that. So I think that to me is always my fondest memory, connecting with people, because the internet, it's not really a visceral thing, right? You're talking to a screen or you're looking at a screen. It's only when you meet and connect with people, you realize that actually what I'm doing does affect somebody out there, because, the screen is not really real, right? So that's in terms of the medicine front. And I think on the dance front, when, now in India and in Asia, when young people put up videos, they tag me to watch and give feedback. And I'm just like, I'm not on the level that they put me on. And I'm like, guys, I'm just a geek who likes to dance. It's but they, they will tag really professional, performers, and they'll tag me alongside it. Oh, please give us feedback. And that's a really humbling moment. Like when sometimes pieces do really well and I get collaborative work, like when Tiger Shroff, the company contacted me to work, and now he follows me on socials and I got to work with their team. So that was kind of a pinch me moment. Like, does that really even happen? Do you know what I mean? To think that you could come home from an AMU shift and your phone is going crazy and you think, what the hell just happened? And it's Tiger Shroff has reposted your story, and then his team gets in touch with you. And so these little things where you get to live a bit of that dream. It wouldn't have happened if I didn't push,
Yeah, absolutely. I mean, it's just blown my mind that Tiger Shroff's company, that's incredible. I cannot believe, that's amazing. Like, it's really, really cool how they got in touch with you. I mean, you're putting yourself down. You're so good. Like, we see your performances on Instagram and we're just blown away by I don't know, you're just so versatile with the way you dance. And it's so
guys, you're being really kind.
Like, you're so creative, and it seems as though you're open to trying so many different things, because often you kind of stick to your own style and become shielded with certain body movements, but you keep it so open, and that's really inspiring to see. So the next question is, when you look back on your journey, who's your inspiration?
Okay, I'm going to be honest about this, right? So when I was in my final year of med school, I didn't know what dancing would look like in a few years, because there was no point of reference. And I mean that. So in the medical world, there were obviously people I looked up to. In the dance world, of course, I had idols like Shakti Mohan and, people at the time who were at the forefront of their fields. But I didn't know anyone who does both to a certain degree, right? I had friends who were doctors and kind of may have done dance projects or other things, but I didn't have a point of reference. And I think that's why a lot of my inner circle, and by that I mean my family, were very like, what are you doing? Are you crazy? this is stupid, you're a doctor now, what do you, I didn't have a lot of support. I have to be very honest. There was no support, right? It was my best friend who was my driving force, and she was the one who was just like, V, you just have to do what keeps you happy, because she knows me enough to know that I work and thrive under pressure, and I just work a bit differently to most people. So I think when you have somebody like that in your life who believes in you, a few positive words can go such a long way. I don't know if you guys can relate, but it really goes a long way. So I didn't have any point of reference to even think of as an inspiration, and that is the truth. Did I look up to amazing dancers and keep kind of pushing myself? Of course, like I said. And even when you say, oh, you're so versatile, and it's so kind of you. So I told myself that to even manage balancing dance alongside such a crazy job, it's not easy, it's hard. So I told myself, if I'm going to do that, every time I create, I need to push myself. I need to do something different. Of course, I can do much simpler routines, and I can do basic Bollywood moves and, like wedding routines and, choreographies for mendis and things like that. And I have done for clients. But I knew that if I'm making time out of this career to put stuff out there, I wanted to be challenging, not just for me, but I needed to elevate others and really push others. So the two styles that I kind of, amalgamated, the Bollywood and Bolly feels. One is more urban, one is a bit more contemporary, lyrical feel. And I kind of made it mold to me a bit. So now when students come to the classes, they will know what to expect. They will know they will be pushed a little bit. They may leave feeling, a bit uncomfortable, but they always message me afterwards saying it's made them stronger in the long run, because you don't want to stay in a room or in any environment. It's not just dance. Even in science, even in business, you don't want to stay in a place where you're too comfortable, because that's not where growth comes from. You want to get into an uncomfortable place. But yeah, so that's what I would say. I wish there was a point of reference, and I think now there is, and I hope there are more professionals who come up in the coming years and days putting out their work to inspire others, because your job has to be a part of your life. But for me, it's not the heart of my life. I think there's a lot of other facets that make a wholesome life, and I didn't want to lose sight of that.
Yeah, definitely. And thank you for that honesty, because, usually when you ask these questions about inspiration, there'll be a name that comes through. But I think that's really nice of you to talk about realistically how you didn't have that point.
Yeah.
Because realistically in medicine, I mean, this is why we're doing this, because we know how much doubt there is out there about balancing with career. Even us ourselves, we're juggling with time, with whatever commitment. And even when I look ahead personally in the future to fourth year, fifth year, I'm scared about not being able to do the things I'm doing right now, like BIMA. And I keep asking for reassurance that can I do this in fourth year? And I usually get a no. I usually get, you're not going to get to do it. I keep getting that from everywhere. And I just think, why not? But when I hear you, it does push me to consider.
But there's the price, Nikita. There is a price. You have to be realistic. You have to sacrifice some other things. Because when there were exams, there was no way I was in the studio, because I physically get exhausted after rehearsals. So then I couldn't study. So in those times, you have to be practical as well. Exams and passing was the priority, and it still was, even in my GP finals, right? So most of last year, with the pandemic, we all got redeployed. Work pressures were crazy. If you check my channel, Ivy Dance, I haven't released a single video in 2020 because I had to prioritize medicine and working on the front line. So I taught a few free Insta Live classes, a few Zoom classes to keep people going in lockdown, but that was more for my sanity. It wasn't to try and hit numbers or anything. It was to keep everybody sane in some form of way. And I'm so proud when I look back at all those things I did. But those years, they were hard. So when you're in fourth year is a very hard year in med school, and you may have to make sacrifices. You may have to lose a few hours of sleep, or you may not get to watch TV or hang out with your friends. So those things for me in uni was rehearsing, training, studio time, so I didn't put that much emphasis on social life, TV, those things I sacrificed a little bit,
Yeah, that makes sense. Yeah, true.
Yeah.
Okay, awesome. So we had a great discussion about, dance and medicine for you. We touched a little bit on sort of work-life balance and inspiration and, fondest memories. So we'll take it to the next section now, which is about more about the challenges and a bit more about work-life balance. So Stiksha.
Yeah, so as a doctor and a dancer, have you ever faced any kind of challenges or limitations to doing, both?
Definitely. So the challenges was the reality of obviously balancing the two, right? So the physical reality, as a dancer, if you want to be at the top of your game or you want to be a certain standard, you have to put the hours in, which means you have to put the time in. Now, when you're on an acute medicine or an A&E rota, that's not something you can easily do, and you're physically exhausted. So I think when it started and when I was in F1, F2, it was more just my annual leave. I would prioritize to either shoot covers or train and a lot of those things. So whenever I had days off, I made the most of my days off. I would like block out a morning or block out an afternoon to train. And by train, I mean not just choreograph, but learn from others that I looked up to, actually work out, work on my stamina, work on my strength, because those things all kind of work together in making you a better performer overall. So that was the reality of that. The challenges would be things like sometimes work finished when it's meant to finish at 5 and you're meant to teach a class at 8, but it doesn't finish at 5 because your last patient may be very acutely unwell and you have to stay behind on the wards till 7. And then you have to rush across London because there are 30 people waiting outside a class that you're about to teach in an hour. So the reality of things like that, of not leaving things too last minute. So I would have to, any of the days that I would teach, I would try and keep everything ready for class first thing in the morning before I go to work. So the bag full of, the speakers, the wires, the backup wires, the notepad with all the choreography. So everything would be packed and ready before I leave for work, so that I know in the back of my head, everything's ready and I just have to go. When things became a bit much, I had to find an assistant because I couldn't do everything myself. There was no way I could answer socials, emails, and do work. And, as a junior doctor, same as in med school, there's training, there's e-portfolio, there's a lot of things behind the scenes that you have to do. So it just wasn't realistic. So once I got the team built up a bit, that got taken off my hands and things got a bit easier. So I could just focus on creating and working, and all the admin got taken care of a little more. So yeah, that's what I did.
That sounds really intense.
Yeah, it sounds really, really intense. And I guess you kind of touched on this, but how do you go about balancing kind of being a professional dancer as well as practicing medicine?
So in what way? Like a day-to-day basis?
Yeah, day to day, yeah.
So for me, I have to compartmentalize. And I'm sure my students would tell you that when I teach, I sometimes use anatomical terms, or maybe a bit more of a scientist when I'm like, your midline and your lateral border of your this thing. And, I may say some things like that. Whereas when I'm with patients, sometimes I get a bit fun with the kids and, I become a bit more animated, but I have to remember that I am still a professional and I have to stay in that, setting. So I try and compartmentalize. When I'm at work, my name's Veena Babu, so I'm Dr. Babu at work. Dr. Veena is just a social media thing, and people just call me Veena in class because I try and keep the two worlds separate. Because when I'm at work, my mindset's different. As a trainee, of course, you have the whole team, but now as a qualified GP, I've been a GP for 5 months, guys, and it's been insane. The responsibility is just something else. As a junior, you could leave work and go home. It's not like that when you're a consultant. You're still thinking about your patients. You're always thinking, what could I have done differently? What could I do better? Should I look up this new medicine that's out? It's at the back of your mind, and they are a priority. So I only think about that when I'm at work. And when I finish that and I'm in my home or in my creative space, I then focus on the art. So to answer your question, to try and do both of them to a standard that they deserve, I have to compartmentalize. Having said that, when ideas sometimes pop up, you don't know when ideas will come. I just kind of jot it down because it's hard to keep track of everything, right? I would just kind of write it down on my phone, and there's like a whole note section of concept ideas, collabs, all these deals that come through that I just make a note of. And one day a week, I just go through those notes and think, is there anything I can pick apart here? Yeah.
Right. You know, this whole process sounds like an adrenaline rush. Like I'm just visualizing your day in my head and how you're just rushing across from place to place, especially across London, and it's blowing my mind on your
like
plate.
a movie almost.
Yeah, it's like a movie.
It's double life.
No, but that's not every day, right? Like when I was teaching, so that's another thing. I would have loved to do regular classes, but I couldn't because the rota changed every 8 weeks on medicine. So I had to create something called a boot camp, which was just 6 week, 8 week classes where I knew what my rota was. So one had to influence the other. So I thought, I only know my rota for the next 8 weeks. So I'm going to create a boot camp, an intense Bollywood boot camp, where I know for these weeks, this day I'm off, or this day I finish a bit early so I can teach. And that's why I could only teach boot camps and not regular classes, because I worked full time.
Yeah. But that makes total sense. It just demonstrates how you balance the two of just practically fitting in what you can in the schedule that you have.
Yeah.
So yeah, that makes total sense. Okay, so taking you back to med school days, because obviously you spoke about how at the time when you were thinking about your passion for dance and balancing things and people around you weren't so encouraging about it, did you have any misconceptions yourself, or was it purely driven by the people around you in terms of your...
It was predominantly people around me, but I guess at the back of your mind, you know that because you're a working clinician, you know, it was a personal thing to me that I wouldn't put anything too promiscuous or too sexy or revealing out on the internet where I'd have to look away, or if my patients saw me, they'd feel a bit uncomfortable. I only say that that's a personal thing, you know. Of course, clinicians put pictures up in bikinis and they're models and things like that, but this was a personal thing to me that I wanted to, especially for the South Asian community, I wanted to put things out to a certain standard where I wanted to be proud of it, and I never wanted to kind of hide it from somebody, or if one of my colleagues or seniors found my work, they would be okay to come and talk to me about it. And that's how it's been so far. So that's something I have at the back of my mind. But then just the realities, guys, of you can't, I wanted to take a few months and go train in something, but I couldn't because I had bills to pay. I couldn't just take off a few months. I had to work. You know, you can't, you know, with medicine, you get like a few days off. So now that I've finished, I have a bit more freedom with my time. But the last 5 years, I couldn't do any of that. I had to turn down loads of projects abroad because I didn't have the leave, or I just couldn't. So those were the sacrifices.
Yeah. Okay. I just wanted to ask, out of curiosity, when did you actually start doing professional dance? Like in med school? Did you start in med school, or did you start after?
Okay. So I've trained since the age of like 4. So I lived in Mumbai for 6 years when I was younger. So I trained in Bharatanatyam and I did Indo jazz with Shamak while I was there. So I came to this country around 13. I was part of Honey's Dance Academy as a teenager, age 16. And within a year, I was teaching classes there. So from my late teens, I've been teaching, performing, choreographing pieces. So we would kind of do, you know, stage shows with, do you remember Raghav and Jaggi D and all, you know, all these artists and lots of musicians. So a lot of what would start off with private events and melas and things like that, then, you know, became competitions and beauty pageants, and it, you know, it was just commercial shows, right? So when you're part of a dance company and you're a freelance dancer, when there's a job, you get told about the job, you turn up, you audition. So the whole thing is very professional, and then you get paid for the job. So that was my first job as a dancer. So I had the basic training, but then I just kept it going from my teens. So all throughout med school, I was working with different companies, freelancing and working for them for shows and things. But then, like when I finished F1, I couldn't, because I was in Northampton as an F1 and I couldn't come for auditions and work in London, and it just didn't make sense. But I didn't want that to be the exit of dance from my life. So that's when I started the YouTube channel.
Oh, okay, that's great. Awesome. Okay, so we're going to move on to our next section, which is a bit more about medical school and, you know, your career itself as a GP. So the first question is kind of continuing on from the previous part. If you had to tell medical students something about work-life balance, what would you tell them?
Oh, I would tell them, do not fail your exams. It's not worth the stress. It's not worth the drama. It's not worth your tuition fees. That's what you're in medical school for. That is your priority.
Yeah.
That's what I would say. So I even made it a personal, I would personally tell myself, I can dance, I can compete, in all these uni shows. So I went to King's and Imperial. We had Diwali show. We used to have Face Off before, and then afterwards it became the other shows. My thing to myself was, you're not allowed to fail an exam. So I would do every single show you can think of, from Afro-Caribbean Society to Gospel Society. I may have done over 35 shows, at uni, but when those 2 or 3 months before exams, you wouldn't find me anywhere. I would just be focused on studying. So that was a priority, because I saw people where they got caught up in the wave and the hype of the shows and the bubble and, all of that. And they failed and they repeated years. Some of them got kicked out. It happens. And I hope that doesn't happen to anyone. So kind of have a tunnel vision of why you're there, obviously, but keep the training and keep that passion alive. Because in uni, a lot of my close friends from dance are now even my close friends, because I didn't end up spending a lot of time with just medics. A lot of them, you will create your lifelong friends there. You may find your other halves there. You may make some amazing memories that in years to come, you're going to look back on. So really live it to the max. When you're doing something, do it properly. That's what I really believe. So if you're in the library or you're studying, give it your all, the whole compartmentalization again. And then when you're training, enjoy that to the fullest, Yeah, that's what I would say.
So moving on to kind of that work-life balance kind of thing, why did you choose GP specifically as your specialty?
Guys, I love this career. I'm not even going to lie. So I love being a generalist. At one point when I finished, I thought I did kind of explore dermatology and surgery, because my seniors at the time thought I'd be good in those careers. And we had discussions. And what I really loved, I also loved pediatrics, but what I loved about peds was, again, that it's a generalist, a generalist for little people. But I think the more I looked at general practice, you need to know a bit about everything. You can decide how and what you want to focus on. You see a patient journey from beginning to end. And that to me was second to none, because being in a hospital where you see patients come in, come out, you would spend, some of them, you'd hold their hands while they took their last breaths. You'd be certifying deaths, doing all kinds of crazy things on nights and on calls, but you never see them again. You would never see their relative again. And I was like, but I want to know what happened to that tumor, or I want to know what happened after they got their infusion. And you could never follow. I mean, you could follow it up if you went back and looked at the notes, but the reality is you never saw that person again. So that's where I wanted to be part of a patient journey from beginning to end, where I was responsible. I had a say in what happens next. So I think a level of that control, a level of independence and career satisfaction. And a big part of it was also, I wanted to not give up dancing. And I didn't think that was realistically possible in the UK while I was full-time a junior trainee in any of the other specialties. Yeah, so that's the truth. Yeah.
And if you hadn't gone into medicine, what career path do you think you would have ended up on instead?
Oh, I always play this game and ask this to myself. The thing is, so there have been weeks where I've, sometimes may have danced every single day or done a lot of creative things, but something was still missing. Medicine gives you that intellectual push that I don't think a lot of things and a lot of careers can, because now as a consultant, I come home from long days and my brain hurts. Like when I say my brain hurts, I'm just like, but I love it. I love how much it challenges you and pushes you. And yes, of course, you have your bread and butter cases, but you also have those unique cases where something goes different. Let's talk about COVID, something as odd as the COVID toes, which is a phenomenon where you see blanching of toes and blue toes in young children as the only sign of COVID. Now, when this first happened, we all started thinking, is this an autoimmune disease? Is this a vascular problem? And we started investigating these children for cardiac concerns. But actually it transpired that they just had COVID 6 months ago and were completely asymptomatic. So, just things like that you can't really explain to a non-medic or a non-scientist, where it just really pushes you and challenges you. I think that's the right word. So I think medicine challenges me, and I really enjoy that intellectual stimulation. So when people ask me, would you pick one or the other? I don't think I could. But if I didn't do this, I'd have to do something equally intellectually challenging. So I don't know. I'd always love to think what being an actor would be like, because you'd have to learn lines, you'd have to be a different character and live a different life. And I don't know. I think I would have, yeah, in an alternative world, I would have loved to be an actor.
You know, I just feel like I'm so happy to hear this, because this is a similar line of thought as me, where I was choosing medicine, and I just thought exactly that. Even if I have an interest in dance or in music, say singing or whatever, there was still a void intellectually.
Yeah, yeah.
So I completely relate to that sentiment. And acting as well. I would have loved to become an actor, but it's so far-fetched.
But it's not as well, because if you want to do it, once upon a time it might have been, but I know people in my family and in my close inner circle who have quit their day jobs and have gone into acting full time, and they've made it. Yeah, they have. Wow. So don't doubt yourself. If you want to do something, you can't doubt yourself. You just have to go for it.
Oh, wow. Oh, that's incredible. We may ask you more about that, actually, like their journey into acting. Okay, perfect. So next question is, I mean, we've already kind of covered this, but is there anything else you want to tell us that you wish you knew about in med school? Anything. It could be anything.
Med school? In med school?
In med school, yeah.
I would say those are going to be some of the best years of your life. I knew this. This is not something I didn't know, so I made the most of it. But I'm telling all of you guys, these are going to be some of the best years of your life, where you can have a line if you want. If you don't turn up to work the next day, it's okay. When you become an adult and you have to go to work, it's not like that. Make the most of learning experiences. Make the most of trying new things. And new, even with art or with languages or different societies, really explore yourself and find who you are and who you want to be. I think a big part of that, trying to picture your life in a few years' time. I wish I knew that. I wasn't trying to picture and think too far ahead. I was very much pass exams, get through next year, pass exams, get through next year. There wasn't much of a kind of a longer vision. So I think if I could look back and tell myself, I would say that, kind of think, where do you want to be? Yes, with medicine, but also with the other areas of your life. Yeah.
I mean, an additional question that's popped in my head is, so you mentioned how at that time you didn't really look ahead, or like with foresight and things like that. Do you think it's important to have foresight, or more to just stay in the present? Because I'm always confused whether I should plan ahead or...
Yeah, so I think it's a bit of both. It definitely is a balance. So even when it comes to, social media and dancing and the arts, people often ask me, where should we start and what should we do? And I always say, you need to kind of think a bit and meditate a little bit about what your purpose with it is, because time is a very valuable asset. And I'm very kind of, I'm very controlling of what I do with my time. I'm very passionate about where I spend my time. So I wouldn't just waste my time doing something, right? So at the beginning, it was just kind of a creative release, and then it kind of became something more for me. And then I thought a bit more of what was my purpose. So to start with, it was just to prove to myself that you don't have to give up your passion if you're an academic. That was it. And I think that's still written on Ivy Dance as a channel. This is to encourage others who want to keep up their work. So that's what I started with. So I would say, if you want to start something, or even in med school, I think you need to think a bit about, what is your purpose with this? Is it just to enjoy yourself? Is it just a fitness hobby? Are you trying to become better? Are you trying to influence others? Are you trying to become a teacher? Are you trying to create an income? So if you have a little bit of a clear vision with that, then you can think a bit ahead. Otherwise, what happens if you don't know what you're doing? You're going to get swayed. Someone will say, oh, do this, you go with that, you will do this, you will do that, and the next thing you know, 4 years have gone, 5 years have gone, and you still don't know what you're doing. So that's why I think you should have a bit of that. And with your question of, you will only get this moment now, right? Like, in this interview, we only get to enjoy this now. So I'm a true believer of making the most of what we have in the present time we have, especially because of the job we're in. Some of the things you see at work, honestly, guys, I'm not even just saying this for effect. I mean it. I truly feel privileged and blessed to be alive, to have this life, to have a body, to have limbs that move. I'm going to share the story with you guys because you can relate to it. I was in F1. It was my peds job. And we had to cannulate this little boy who came in. He was 7 years old. Now, he had a rare form of leukemia, and he would have to come in 3 times a week to get blood transfusions. So the nurse was trying to get the line in, and she didn't get it. And she went to change the needle, and he went, "Uh-oh, you missed. Try again. You'll get it next time." And that's what he said. And I remember thinking, oh my God, now that is courage. Like, what do I have to complain about? You know what I mean? This is a 7-year-old where he should be playing and running around, and he's spending a good few hours 3 times a week, similar to dialysis, right? Children with kidney transplants. They spend hours on wards and you just think, you have nothing to complain about. We have everything we need to make what we want of our lives. So I think that sense of mortality, I have like that true sense of mortality. We're here for a limited time. So you have to just be in the present, do your best, and not kind of get complacent. So whenever you get complacent, tell yourself that, and I think you'll see more of it the more you are on wards and the more you see patients and people's lives. You'll really start to feel that, I'm sure.
Yeah, that's so inspiring. Like, it just makes me more excited for our years ahead in clinical. I mean, it's a fine balance, isn't it? Where you're going to be seeing people who are really unwell, which isn't ideal, but also it's a learning experience. It's a weird double-edged sword where you don't want people to be ill, but then you do see cases, and it's a
privilege. It's a privilege. I train students for medical and dental interviews, right? Preparation. I always tell them it's a privilege. Think about it. When do you see your dentist? You might just go for a routine check. You might just go, once every 6 months. You don't just go to your doctor to say hello. You don't want to go, but you go when you're unwell, So as clinicians, you see patients at their most vulnerable. It's a very, very privileged position. They don't just come there, right? Think about it. They don't come there just to say hello or check in on you. They come because something hurts, something's broken, there's bleeding from somewhere that shouldn't be there. And you're there to fix that problem, and you're there to put the pieces together. So it's a very privileged position. And I feel I am really passionate about medicine. I love the job. And I'm quite vocal about it on socials as well, because I think it's important to know, because I think there's a lot of medical professionals, I don't know if you've come across them, who are not very happy in their jobs and who might only talk about the negatives. But I do think it's a very privileged job, and I'm quite lucky to be in it. Yeah,
definitely. Do you feel like the politics of the profession gets to you sometimes? Have you faced anything like that where it's made you doubt almost what you chose?
In what way?
I don't know, because when you speak to professionals, they always speak about how they love the job itself, but they're only put off by it because of the politics within, the NHS, if you like. So have you ever faced moments like that, or any moment of doubt?
No. So I think it depends on what specialty you're in, I guess.
Right.
So with general practice, the admin is never ending. It's never. So when you discharge patients from hospital and you write that little line as a junior doctor, GP to follow up. So every time we write that line, we have to follow that up. Okay. So it comes into our admin folder. They would have had bloods done today, and it would say GP to repeat bloods day after tomorrow. Why? I know it's some F1 sitting on a ward writing this with no sense of what they're doing, and they just need to write something. I'm watching you, right? You juniors out there. We get these letters, and we're just like, there was a meme about it. Someone made a meme of how people discharge patients into the community, like, chest pain, GP to follow up, PR bleeding, GP to follow up, GP to follow up. And then we have to follow that. I know we're laughing about it, but obviously sometimes there are valid cases, but often
Right.
You're literally following the patient up saying, so you were in hospital recently, how are you doing? The admin is a lot. And if the admin was not there, for instance, you have 10 minutes to see a patient, document everything succinctly so that nothing goes wrong or anything. It's a lot, and 18 to 20 patients per clinic, which is 3 hours. It does get quite intense. So if I had someone who could just scribe for me, if something automatically got written and you could just focus on the medicine, the job would be amazing. But that's with anything, right? Think of accountants, lawyers, any field. You have the good and you have the stuff you have to kind of work on. So, and that's also in the country we're in. I'm sure some countries have scribes or PAs and other things. It's part of the NHS as well. So I've never really faced any politics. Yes, when I was a medical student, maybe consultants would ask a question, just look at the boys for an answer. So stuff like that. I guess more with the dance field, where people would come and ask me when I'm stopping or when am I planning to give up and all of that. But I don't imagine they would ask that if I was a man. If I was a man and a choreographer and a doctor, I don't think they would ask, oh, when you plan to stop? They wouldn't. Yeah. So things like that, it just makes you, I guess it makes you remember, like, you know, you're a woman, and in society and in life, obviously your place and responsibilities are different, but more so people's perceptions and their expectations of what you need to do, when you should do, it's so different as a woman. So that's a whole different topic. But as you get older, you really come into your own, and you realize actually you don't need to meet up and match up all of that, because if you did, I wouldn't be sitting here talking to you guys. I would have just been doing medicine full time and never have shared anything about my life.
Oh gosh, that's a scary thought. That's a really scary thought.
No, but you would have been a whole different person, right?
Yeah.
Because exactly what you said, Nikita, in final year, everyone told me, don't dance, you're going to fail. And I listened to them because I didn't want to fail. So I didn't dance at all. I passed and I was fine. But I did have a lot of spare time. In hindsight, I did. I could have if I wanted to, but I just gave in to what people said. So that's when I made a decision. I think they come from a good place, obviously, because they care about you, but you also need to know yourself and know what you're capable of, and kind of go with that.
Right. Yeah.
Yeah.
Okay, so we're going to move on to a more sort of the buzz phrase these is social media. It's quite a big topic these days, and we're going to talk a bit about that. So we'll throw the first question.
Yeah, so how did you manage to build up your you have such a large following on social media. How did you build up that large following and build your social media presence?
Oh, thanks, guys. It's not that big. But it is bigger than your average, just as a normal private account, I guess. So it wasn't a conscious effort, if I'm honest. I was just doing what I love, and it just went from there. And that is the honest truth. When I started, if you go down on my feed, from when I was in F1, I would post the odd photo from long day shifts or long days at work. But at that time, I was trying to figure out what I'm doing with dance. So when I started, it was a group of us girls. I called it Lady Rogue. There were just a couple of covers we did, some Hindi, some Tamil. And then that got a bit of reach, and we got some collaborations, and we got, some music companies approached us. So when I started getting those opportunities, I decided, actually, I really want to pursue the dance more. And people want to see it, and people then wanted to learn from it. So I started sharing more and more of that. So I guess the following just came from people connecting and relating to that. So it wasn't a conscious effort of what do I do for numbers or what should I do? But it is a pressure, of course, because if you release something and it, hits 1 million, and then you obviously put that pressure on yourself of, oh, my next one has to be the same level. And I remember once when I was at YouTube, one of my mentors explained this to me, that everything does not have to be the diamond. You can have some gold, you can have some silver, you can have some bronze, or even some copper, but you need to focus on now and again delivering a diamond. So I think the premature me would have thought everything needs to be a diamond, and you're killing yourself, each time. But that was just really unrealistic. And I've talked about this often. The parallel I've drawn is in academics, where you put the work in, you will get a result. If you slog away, you work hard, you will get that grade, you will get that distinction, you will get that scholarship, no doubt about it, right? However, in the arts, it's not like that. You could put your hours in, you could train, you could film something amazing, but it may not connect, it may not reach to anyone. Or there might be the odd thing you kind of just recorded off a whim, and that could go viral. So my first solo performance, I think it was to a song called Teri Khair Mangdi. It was my first ever, what I now call Bolly Feels. Back then it was just me dancing, and everyone kept saying, what is the style? What are you doing? Are you doing yoga? It was quite funny. And then it made me think, and everyone kept asking, what is the style you're doing? But to me, it was just, I'm just dancing. So then I created a style to explain that this is what it is. And then everyone stopped asking me questions. But that only got filmed because we were going to record a whole group routine. And I was driving from Northampton or Leicester to come to London to film it. And 15 minutes before reaching the studio, some of the girls got ill, somebody couldn't make it, something else happened. So everybody bailed, and my camera got, my cinematographer was still coming, and I had booked the studio, I'd paid for everything, and I thought, I'm not wasting this. So I kind of just did it. Wow. And that then hit 1 million in 2 months. And it was not a plan. It was just kind of, do you see what I mean? So what I've learned is in the creative world, it's not necessarily effort does not equal success, and effort does not, it's a mix of luck, contacts, opportunity. It's a mix of a lot of factors, right? Whereas with academics, it's a bit different. It's a bit more stable. It's a bit more secure. If you turn up to work, you do what you have to do, go home, you get paid at the end of the month, you know. If you publish something, it gets released, you get a bit of recognition, you can contribute to the academic world. It's a bit different. So that's the difference in the two worlds. Yeah.
There is definitely a lot more room for subjectivity in arts compared to academics, isn't it?
Definitely. And you're not going to please everyone. You're not there to please everyone, you know. You go on Beyonce's video, and if people have the audacity to dislike that, I'm sorry, who are you? You know what I mean? Like, if people can go and dislike Queen's, I'm sorry, like, you know, you're never going to please people, and that's fine. That's not your job. It's more just kind of staying true to yourself. I think that's key. Yeah.
Yeah, for sure. Okay.
Yeah.
No, go ahead.
You kind of touched on this a bit before, but how do you kind of navigate and cope with those pressures on social media?
It's hard. I'm not going to lie. It is hard because there was a point where I was delivering a lot of covers, and then you get lots of messages and emails. Oh, please do this cover. Please do that. Teach us this. Do this. And then there would, you know, that gets lost in between other things. So for me, when some of the labels started contacting me, so SME, which is Sony Music, and Tips contacted me to work together on certain collabs and videos. So then negotiating and working around that, where I would have to tell them, you need to pay my overheads, you need to pay me, I can't just do this for free. And, you know, they would talk about the whole exposure. You would get exposure. I was like, I don't need exposure. I'm not a celebrity. I'm not looking for exposure. My time is valuable. If I'm putting hours into a studio, and this is London, it's pounds, it's expensive. And this is the reality, it is expensive, right? You're putting all that money in, you can't just keep doing things for free. So it was also understanding the business aspect of it, where if you have a unique offering point and you have a unique selling point, if you're going to monetize it, you need to do it professionally. You know, it wasn't just kind of, so it was a lot of learning, it was a lot of challenges, but I really enjoyed it, kind of figuring out how to negotiate, how to talk, how to draft those emails. And obviously I was able to do lots of amazing things as well. Like we raised money for GOSH, we raised money for the Kerala floods, we raised money for the RSPC blind charity, you know, the Blind Association for the UK. So a lot of my covers were purpose-led as well. And that's why even with Ivy Dance, I've kept it as dance with a purpose. That's what I always try and kind of instill. It's not, of course we do dance sometimes with no purpose, just for happiness. But for me, I created Ivy Dance with having dance with a purpose. Yeah.
Yeah, and I sort of taking you back to what you said initially about, you know, social media and chasing the numbers. You know how you said it just happened naturally. I think that's the best part, isn't it? Is that you don't force it, and it just happens purely because of people connecting with you.
Yeah,
chasing a number, right?
I think I was. I was quite blessed in that sense, because even last year where I had exams and for 3-4 months I completely disappeared, and you notice your numbers dropping and people stop following you because you're not putting content out, you're not creating, and you did feel the pressure, or should I still be fitting it in? But I thought to myself, no, because I have to practice what I preach. It's time now to focus on exams, and I can focus on this afterwards, you know? So not losing that sense of what is a priority at what point in your life. For instance, you know, as young women, when you get older, you know, it might be a time to find your partner or give time to a parent who's unwell, or you might have to work on a certain project. And that's personal to your story. And you have to prioritize those things in your life, because each of our lives are different. And you can't always meet these high expectations, unless obviously you're doing it full time. You have an agent, you have someone who makes a schedule for you, who navigates those deals, and then you go from there. But having said that, it's also like these days, if people want to start and get going, consistency is key. You just have to be consistent with it. Everything may not connect with people, but you have to be consistent, and growth will come from that. Yeah.
And in terms of, obviously, with your following, do you have colleagues at work come up to you, or have you had patients come up to you and say, oh, we recognize you, and, you know?
Yeah, sometimes. So I like keeping my worlds apart, because like we were saying, you know, like I like to just be at work and be a different version of me there, and a different part of my personality at dance. But yes, I've had patients where they've been like, Veena Babu. I'm just like, oh no. I was just like, yes. But then it's really nice. But then I have to kind of bring them back to, because remember, I only have 10 minutes in this consultation. Right. I have to bring them back to. So there are those challenges. So it's always really nice. And, you know, they will say something sweet and be like, my little one watches you, or my, you know, daughter or son watches you. And it's really sweet. And at the practice now, we have this running joke wherever there's a, you know, like a staff meeting day or a group day, or Veena's going to teach us all a routine, or, you know, all of, so it's just, I think everyone's quite encouraging. I think in medicine, you would think that colleagues would be more judgmental, but actually they're very supportive. They encourage me to work less and focus more on the arts. A lot of my seniors actually. And I think it makes you a bit interesting as well. You know, it's like, oh, you do something a bit different. But I think I faced a lot more judgment on the dance world and the creative scene, where I would go if I was on a professional shoot, or, you know, on a movie or a music video shoot, and you see professional choreographers and people who do this for a living day in, day out, they may not see you with the same respect as, say, the person who hired you, like the director, because they obviously, you know, they know you're a professional and they give you a lot of respect. But to people who do this full time, they might think, but you're not even that serious about this, you know, you have another job. Do you see what I mean? Right. So I have a lot of respect for the craft and artists who do this full time, because they have months maybe of no work, sometimes months with lots of work, the physical strain on their body, the financial strain, you know, we can't ignore that, right? So that's why I'm quite open about, I don't do this full time. So if I am not to the best standard, please forgive me, because I also have to work full time, you know, and that's the truth. Because if I'm going to charge people to teach them, I need to make sure I'm at it. I can't just, you know, wake up one day and think I'm going to teach people and charge them. Do you know what I mean? But I'm confident, because I've had, you know, I've been doing it for more than 10, 15 years. I know I can, and it's fine. But it's more, like I said, it's more just kind of understanding which area, what the challenges and the preconceptions are. Yeah.
Yeah, and I really appreciate that outlook that you have, keeping the two separate, because it's very hard to get swayed, isn't it, and mix the two. And especially when people come to you in your workplace and tell you about the other thing, you can get quite but that's good, you said.
Yeah, so it's better to just kind of keep it separate, and there's no need for it to be, you know, unless sometimes at work you encourage patients, you know, actually you should exercise, or you should dance, you should do something. And often when I was, you know, they think you're a young doctor, they're like, oh, but how old are you, and all of this. You say, oh, you know, it's because I dance, I do this. So you bring it in there and encourage them. So that's where I would just bring it in, but not otherwise. Like, I obviously wouldn't bring it in, but if they, yeah.
Okay, so we're coming to the last part of our interview now, which is about looking forward. So Sniksha, take it away.
Yeah, so how do you stay connected to your culture and roots? You know, is dance that medium to you, or is there anything else that you do?
Oh, that's such a beautiful question. That is a really good question. So I'm Christian. So culturally, India, so I grew up in India. I lived there for 6-7 years, and that's where I learned the art of dance. Now, I always think, if I grew up here, would I have still trained the same way? Would I have still had the same connection? I don't know. But I think my story was such that I lived in different countries, and India being one of them. I learned to read and write Hindi, and I learned all my dance there. It does connect me. And I said I was Christian because we don't really celebrate Diwali or any of the other Hindu festivals here anymore. But when I lived in India, we did, you know, the Ganesh festival, the Holi, Diwali. We would celebrate everything because it was culture. That was your Indian culture, right? Whereas when we moved, now it's mainly just Easter, Christmas, and I would maybe go and kind of watch Navratri or get involved, but not really to the level that we did when we lived in India. So yeah, I think art and dance keeps me close to my roots. And I think that's why even teaching the fusion that I teach, I wanted it to be a reflection of my Indian origins and my Western upbringing, because that's the amalgamation that allows me to deliver the craft. Because I'd be lying if I said it was just kind of one-sided. But that's a really good question, actually. Yeah, I hadn't really thought of that.
Yeah. And what do you want people to take away from the work that you do in both medicine and dance?
I would just say, if there is that one thing that makes you feel alive, you shouldn't stop it. No matter what anyone says, no matter what doubts you have in your heart about it, you need to keep doing it for you. You know, life is hard enough as it is, with challenges, with obstacles, with people's expectations, your expectations. But I think doing that one thing for yourself is needed, because you don't know who you might inspire on the way. You don't know what opportunities will come. You just don't know. The possibilities are endless. The internet makes the world a very small place, you know, very small place. So I would say, if you have a passion or you have a desire to pursue something, even as a professional, on the side, please do it, because there's no better time than today.
That's such a beautiful message.
Yeah, honestly. Wow, that's amazing. Okay, so you've already achieved so much, but you know, looking forward, what's your next challenge? What do you want to do next?
Okay, there's so much. Oh goodness. So there are some projects in the pipeline, but I'm also in talks with the Royal College of General Practitioners about working a bit closely with them about encouraging our community to move to focus on physical health, to bring down the burden of chronic diseases like diabetes, hypertension, preventable diseases, right? Because prevention is where we should focus our energy on, and being in general practice, that is core and that is the pinnacle of what we do. So I really feel passionate about that. So I want to focus a bit on how I can take the arts and movement and deliver it to my medical community in terms of in respect to my patients. Yeah.
Yeah, well, that sounds fantastic. And I think that's a really good incentive for us as well, because we're in GP placement right now.
Yeah.
And we're so, obviously we get carried away with guidelines and, you know, reminding ourselves of the pathophysiology, if you like. We kind of forget a sense of, you're treating a person, and we kind of have the opportunity to talk to people and a bit more about them, as opposed to just focusing on the responsibility part, if you like. So,
and that is key. Unless you make a management plan unique to the patient, take it from me, they're not going to listen to you. They're going to say yeah. They won't do it. When you see them at their follow-up, like, did you do that? No. So you have to do it uniquely to them. Right. You know, if they say, I go shopping on a Tuesday and I do this, then you fit what you want to say to them in that. So why don't you try carrying your bags? While you're carrying it, why don't you flex your arms? Why don't you get off 2 stops earlier, walk home, for, you know, someone who's never done exercise? So those realistic things is what will help a management plan of a patient, rather than things that textbooks teach you. You know, the guidelines say 30 minutes 5 times a week, moderate exercise for everyone. It's not realistic.
That's true. That is true. Okay, so that was amazing. That was absolutely fantastic. That, you know, I just feel like, I mean, Sadiq will feel the same, I'm sure. But I just feel like, you know, when you have family and you have friends who are inspiration, but I honestly feel, after speaking to you, you've reminded me of so many different things that I genuinely feel you're an inspiration for the rest.
No, you're being too kind. Stop. No. I'm just trying to do justice to what I feel strongly and passionate about. So you guys even saying this means the world to me. Thank you so much.
No, honestly, thank you. Sadiq, did you want to?
Yeah, no, I feel like a lot of the things you've mentioned, they're things that I knew about or I was aware of, but I feel like someone just telling you those things and having, you know, you having gone through that journey and telling us these messages and these lessons you've learned along the way, I think it's really, really powerful to hear it from someone who's gone through it. Because I feel like, especially when it comes to balancing the, you know, the dance and the medicine, so many people are like, oh yeah, you could probably do that, or you can't do that. But no one actually gives you no one's done it themselves to be like, exactly. This is how you should do it, or this
exactly. And that was my thing, right? Because the point of reference thing, there was no point of reference who shared the medical life and shared the challenges, or shared what success looks like in that area, right? Or the struggles. And now I feel like with this new generation, there are so many people now that people can look up to or relate to. I think anything is really achievable. So I agree with you. Yeah.
That's incredibly admirable. The fact that, you know, you're in a time point where there's no one to sort of look up to, and you're kind of one of the first or the few people who makes that move. Because usually you have to look at you have to look at somebody to do something, right? But when you don't have that.
But I think, but the challenges of that, girls, right? So I'll again share a personal story. I was with a close friend, and you know, he asked me, so, you know, why are you putting so much energy into this? You have like 2 degrees, you're so qualified, you want to leave all of that and go do cartwheels on a stage? Doesn't make any sense. he was a well-wisher, don't get me wrong, but it was and he was like, so okay, where do you see yourself? You want to leave all this and go be a dance teacher? Those were his words. You're going to leave this and go be a dance teacher. And I remember thinking, no, it's not that. But I didn't know the answer, because I didn't know where, in 2015, I didn't know where the dance channel or my Insta page or the opportunities that were, I didn't know what was going to come, because with social media and with, this whole point of referencing, I didn't know the answer. So I, again, was taught to believe that, oh, if I pursue this, is that it? Am I just going to end up having to teach dance as a teacher? Is that going to be all I can do? So when people put that box, again, it's not his fault, but that's all he had seen before. Right. Do you see what I mean? So everyone has these preconceptions based on what they're exposed to, so it's not their fault, and you can't feel, kind of negate them for that. But I think you also have to remember that when that inner voice tells you, no, I'm going to still do it, you listen to that voice, even though others around you tell you no. I'm not saying, oh, if your inner voice tells you leave med school, don't listen to that voice. I'm talking about, those challenges where it's going to be hard. There'll be sleepless nights. There have been nights where I had to teach myself how to edit my videos, so I didn't have to outsource that. I had to teach myself. So at the beginning, it would take hours and hours. After long days at work, I would sit there editing. But now I can do it a lot quicker, So you pick up skills, you pick up contacts, you learn a lot. But often people may not understand your vision and your life because you don't know what it is. But that's okay. And that's something now, looking back, I wish I could tell that younger me that it's going to be okay. Yeah.
Well, that's fantastic. So I think we'll end the interview there. But thank you so much for.
You're very welcome. Thanks for having me, guys. I love talking to you too.
Thank you so much. And I'm sure people who see this are I'm sure they're going to appreciate this. And I wouldn't be surprised if people got in touch with us saying thank you. I really genuinely believe that you've shared a lot of amazing nuggets of wisdom. So.
Oh, you're very welcome. Thank you so much for having me.
Thank you.